Okay, so tell us a little bit about who you are.
My name's Lindel, and I'm a busy mom, and I'm a fire captain paramedic for the city of Glendale.
So what brings you into the office?
So 2.5 years ago, I had a complete right hip replacement, and it was literally life-changing. And so here we are, fast forward, I have to get the other hip done, and I had it done 2 weeks ago, and I feel tremendous. Like, it's literally life-changing surgery.
And what made you choose Dr. Gough over all the other kind of options out there that you had, even thinking back to your first hip replacement that you had done with him?
So I had a close friend and coworker who had found Dr. Gough through his physical therapist. And I saw firsthand the dramatic change in his life and his complete ability now to play hockey and do all the things that he loved to do. And so I asked him who his surgeon was, and that's how I found Dr. Gough.
Lindel, what are some things that you're able to do now, even 2 weeks post-operatively, that you couldn't do before your surgery?
So before my surgery, I really struggled to hike and ride my mountain bike and walk my dog and do my job. And all those things were obviously very important to me. And riding my bike and hiking and walking my dog are some of the things I enjoy most in life, and they keep me healthy. And all those things were extremely painful with my hip being the way it was. And immediately after surgery, I felt better, and I'm looking forward to being able to do those things in the next few days.
So, Lindel, what advice would you give to someone who is thinking about surgery or been told they need surgery and is really kind of scared to do that?
So that was totally me before I found Dr. Gough. I was terrified of getting a hip replacement. I'd been told by several doctors that I have to get a hip replacement, that there was no other way for me to ever have any relief from the pain. And so I found Dr. Gough, and I found out that hip replacement surgery is not career ending, it's literally like life changing. And I found out that he does a method that is so minimally invasive and the recovery is so quick that I was reassured right away. And so I was able to go ahead and do the surgery, and it was beyond my wildest dreams. It was better than I had ever even expected.
That's awesome.
Are you sure? 'Cause I feel like I stumbled.
So, Lindel, thank you so much for being here, sharing your story with not only myself, but like all of the patients that we have. And we really appreciate you taking the time to do this for us today. Thank you.
It's my pleasure.